One glass of this juice can turn a normal dose of your medication into something closer to an overdose. It is not a supplement. It is not a drug. It is a fruit. And there is a very good chance it is in your kitchen right now. Grapefruit interferes with more than 85 medications. For 43 of them, the consequences can be life-threatening. That figure is not from a wellness website. It comes from a review published in the Canadian Medical Association Journal by Dr. David Bailey, who is the researcher who discovered this interaction in the first place. And here is the line from that paper that matters most to the people watching this video. Older patients have the greatest chance of taking an affected medication and drinking grapefruit, and they are the most vulnerable to the consequences. So in the next few minutes, I'm going to tell you exactly which categories of medication are affected. I am going to tell you about the most common mistake people make when they try to avoid this, which is a timing trick that does not work at all. I am going to name 3 other fruits that do the same thing, including one that is probably in your fridge in a jar. And I am going to give you the single easiest fix, which for many people is a 5-minute conversation that removes the problem permanently without giving up the fruit. Let me start with how this was found, because it is a genuinely good story. In the late 1980s, researchers were running a study on a blood pressure medication and alcohol. They needed something to disguise the taste of the alcohol, so participants could not tell what they were drinking. Somebody in the lab suggested grapefruit juice because it was strong enough to mask it. When the results came back, the drug levels in the blood were far higher than anyone expected. The grapefruit was not a neutral ingredient. It had changed the experiment. That accident opened up an entire field of food and drug interaction research. Now let me explain the mechanism, because once you understand it, the practical advice makes sense. When you swallow a tablet, it does not go straight into your bloodstream. The lining of your small intestine contains an enzyme called CYP3A4. That enzyme breaks down a large proportion of oral medications before they ever reach your circulation. This is deliberate. Drug doses are calculated on the assumption that this enzyme will destroy a predictable share of every tablet. The dose on your prescription already accounts for it. Now, grapefruit contains a class of compounds called furanocoumarins. The main ones are bergamottin and a related compound with a long name I will spare you. These compounds do not slow that enzyme down, they destroy it, and here is the word that matters. The inhibition is irreversible. The enzyme molecules are not temporarily blocked. They are permanently disabled, and your body has to manufacture new ones from scratch. So picture what happens next. You take your tablet. The gatekeeper that was supposed to break down most of it is gone. Far more of the drug crosses into your bloodstream than the prescriber intended. You have not changed your dose, but your body is now absorbing a much larger fraction of it. Now, 3 numbers that make this concrete. A single glass of grapefruit juice begins destroying intestinal CYP3A4 within about 30 minutes. Full recovery of that enzyme activity takes somewhere between 24 and 72 hours. And in a well-documented example, a person taking simvastatin who drinks a small glass of grapefruit juice, around 200 milliliters, once a day for 3 days, can see their blood levels of that drug triple. From a small glass of juice, 3 days running. That brings me to the mistake I promised you at the start. An enormous number of people, when they learn about this, come to a sensible sounding conclusion. They decide to separate them, juice in the morning, tablet at night, or the other way around. It does not work, and now you know why. Because the enzyme is destroyed rather than temporarily occupied, the effect persists for a day to 3 days after the last glass. Your tablet at bedtime is still meeting an intestine with no gatekeeper in it. Bailey's paper is explicit on this point. It is not enough to avoid taking your medicine at the same time as grapefruit. If you take an affected medication, the fruit has to go, or the medication has to change. Which brings me to the categories, and I want to go through the main ones. Statins first, because they are the most commonly prescribed drug in this whole discussion. And because here the news is genuinely good. Not all statins are affected. This is the single most useful thing in this video, so please listen carefully. The statins that are broken down by CYP3A4 and therefore interact with grapefruit are simvastatin, sold as Zocor, lovastatin, sold as Mevacor, and atorvastatin, sold as Lipitor, though atorvastatin is the least affected of those three. The statins that are not meaningfully affected are rosuvastatin, sold as Crestor, pravastatin, sold as Pravachol, and fluvastatin, sold as Lescol. Those three are metabolized differently, and grapefruit does not interfere with them in the same way. Do you see the opportunity there? If you love grapefruit and you take simvastatin, you do not necessarily have to give up either one. There may be an equivalent alternative that removes the interaction entirely. That is a conversation with your prescriber, and it is a short one. Now, why does this matter with a statin specifically? The concern is a condition called rhabdomyolysis. That is severe muscle breakdown, where damaged muscle tissue releases its contents into the blood and can overwhelm the kidneys. It requires hospital treatment and it can cause acute kidney failure. It is rare, but the risk is dose-related, and grapefruit effectively raises your dose without anyone deciding to. I will give you the warning signs at the end of this video. Category 2 is calcium channel blockers, used for blood pressure and angina. Felodipine is the classic example, and it is the drug that was in that original accidental discovery. Nifedipine, amlodipine, and others in this family can also be affected to varying degrees. The consequence here is a blood pressure drop that is larger than intended, along with flushing, headache, and a rapid heartbeat. In an older adult, an unexpectedly large drop in blood pressure means dizziness on standing, and dizziness on standing means falls. Category 3 is heart rhythm medication, and amiodarone in particular. One study found grapefruit juice increased the area under the curve for amiodarone by around 50% and peak concentration by 84%. Rhythm drugs have narrow margins, and some of the serious outcomes listed in the literature for this whole interaction include a dangerous rhythm disturbance called torsade de pointes. Category 4 covers several others worth naming. Certain anti-anxiety and sedative medications, buspirone concentrations increased more than fourfold in one review. Diazepam roughly tripled. Immunosuppressants used after organ transplant, where blood levels are monitored precisely for good reason. Some oncology medications, certain drugs for erectile dysfunction, which matters given what I have discussed in other videos, and some pain medications, where the risk listed is respiratory depression. Bailey's paper lists the serious potential outcomes across all these categories: torsade de pointes, rhabdomyolysis, bone marrow toxicity, respiratory depression, gastrointestinal bleeding, and kidney toxicity. That is not a list of theoretical inconveniences. If this is useful to you, tell me in the comments whether anyone has ever mentioned grapefruit to you when handing over a prescription. I read every one, and I would genuinely like to know how often this gets said. Now, the other fruits, because grapefruit is not alone, the furanocoumarins responsible are found in several related citrus fruits. Seville oranges are the main one to know. You may not think you eat them, but Seville oranges are the traditional base of orange marmalade. If there is a jar of marmalade in your fridge, check the label. Pomelos also contain them, and pomelos are the ancestral parent of the grapefruit. Tangelos, which are a cross involving that family, are also on the list. Now the reassuring half. Ordinary sweet oranges, the kind in standard orange juice, do not contain these compounds in meaningful amounts and are not a problem. Neither are most everyday lemons. So this is a specific family of fruit, not all citrus, and I do not want anybody giving up their morning orange juice unnecessarily. Now, how much grapefruit is too much? I want to be honest here. The literature does not give one clean threshold because it depends on the drug, the dose, and the individual. What the research does show is that the amounts involved are modest. A single 200 milliliter glass is enough to produce measurable effects. That is under 7 ounces. Whole fruit segments produce the interaction too, not just juice. So this is not about heavy consumption. An ordinary breakfast portion is within the range that has been studied. Now here is exactly what I would like you to do tonight, and it takes about 10 minutes. First, go and look at what is in your fridge and fruit bowl. Grapefruit, grapefruit juice, pomelo, tangelo, marmalade. Second, get out your medication bottles, the actual bottles, not a list from memory. Third, and this is the important step, call your pharmacist or take the bottles to the counter. Ask this exact question: do any of my medications interact with grapefruit? Your pharmacist can check this in under 2 minutes. The service is free, and it is one of the most underused resources in healthcare. Do not try to work this out from a website, because your specific dose, your kidney function, and your other medications all matter. And fourth, if the answer is yes, do not simply stop your medication. Please hear that clearly. If you take simvastatin and you love grapefruit, the answer is not to quit the statin. The answer is either to give up the fruit or to ask about switching to one of the statins that does not interact. Both of those are safe. Stopping a statin on your own, particularly after a heart attack or a stent, is genuinely dangerous, and I have made a whole video about that. 3 honest statements before I close. The severity of this interaction varies enormously between drugs, and for some of the 85, the effect is modest rather than dangerous. Individual variation is substantial, and 2 people on the same dose can respond quite differently. And this video is education, not medical advice. I am a physician, but I am not your physician, and your pharmacist is better placed than I am to check your specific list. Now, the warning signs, and these matter. If you take a statin and you develop unexplained muscle pain, tenderness, or weakness, particularly if it is widespread rather than in one joint, that needs medical attention. If that muscle pain comes with dark, cola-colored urine, that is a medical emergency and needs to be seen the same day, because it can indicate rhabdomyolysis and kidney injury. New or worsening dizziness on standing, or a fall after any change in your diet or medication is worth reporting rather than absorbing. And palpitations, fainting, or a racing heart in someone on rhythm medication needs urgent assessment. Let me finish with why I made this particular video. Most of the dangerous things in medicine announce themselves. They come with a label, a warning, a pharmacist's sticker. This one comes in a bag from the supermarket, marketed as one of the healthiest things you can eat. And that is precisely the problem. Nobody looks at a grapefruit and thinks about pharmacology. The people most likely to be eating it are the people most likely to be on 4 or 5 medications, and that overlap is exactly what Bailey's paper warned about. So please go and check. It costs you a phone call. And tell me in the comments what you found, because I suspect some of you are going to discover a jar of marmalade and a bottle of simvastatin sitting about 10 feet apart. Take care of yourselves, and I will see you in the next one.